This is a brief quiz on the muscles of facial expression found on this anatomical head and neck model. I'll point out the muscle and give you some time to name out each muscle before revealing the answer and giving you a brief description about it. The list of possible answers are in the description below. Let's get started. Name this muscle. So this muscle has no bony attachments. It encircles the lips and has fibers that blend into the surrounding muscle and fascia. This is the orbicularis oris muscle. Orbicularis, it's circular. Oris, referring to the mouth. This is the muscle that puckers up, aka the kissing muscle. Name this muscle. Now this muscle has no bony attachment. It originates over the fascia of the parotid gland as well as the masseter muscle, and it inserts in the modiolus, corner of the mouth. This is referred to as the risorius muscle. It is a smiling muscle in that it pulls the lips laterally, but it doesn't pull them superiorly, so it creates kind of like a cheeky smile. It's not a genuine smile without that upward pull. And when it's activated on one side of the mouth, it creates an asymmetrical smirk. Name this muscle. Now, I'm also going to reference this skull model over here for origins and insertions. Now, unlike most skeletal muscles that cross over joints, such as the masseter muscle here with the red origin, blue insertion, when it contracts, it causes the jaw to close. The facial muscles, they all have origins here in red directly from the skull, some directly from fascia, and they insert into other fascia, muscle, or skin. Thus, we don't see any blue insertions on the front of the skull and facial bones here. Now, the muscle in question over here originates from the zygomatic bone right here, and it inserts into the modiolus, aka the corner of the mouth. This is the zygomaticus major muscle. Zygomaticus comes from, because it's originated from the zygomatic bone. Now, if you did say zygomaticus minor muscle, this one right here, you're actually really close. Now, the name difference between them, major being larger than the minor. Now, they're relatively close in size. However, you can use them saying that the major carries the minor, meaning that the major muscle is on bottom and it's carrying the minor muscle above it. Now, the function of the zygomaticus major muscle is to pull the corner of the mouth laterally as well as a bit superiorly, and you can call it the laughing muscle since it produces a genuine smile. Note that it is bifid right here, meaning it has a bifurcation or split right there, so it means it has two different bellies, or it can rather. So the zygomaticus major, because of that split right there, can be a cause of cheek dimples. Name this muscle. Here is our origin, the incisive fossa just below some of the teeth roots. The insertion is the skin of the chin, although it's cut off here so you can't see it. It functions to wrinkle the chin and protrude the lower lip. This is the mentalis muscle. Given its action of protruding the lower lip, it can be referred to as the pouting muscle, or in more recent years, it's been known to be responsible for the duck face selfie. Name this muscle. Here is our origin, just below the mental foramen. It inserts into the modiolus, the corner of the mouth. This is the depressor anguli oris muscle. Knowing the origin insertions, you can figure out the name. Depressor, it lowers. Anguli, the angle. Oris, it lowers the angle of the mouth. It can be referred to as the unhappy muscle because it helps create a frown. Name this muscle. Here is our origin, the oblique line of the mandible between the mental foramen and the mandibular symphysis, where both halves of the mandible fuse. It inserts into the lower part of the lips more laterally here. This is the depressor labii inferioris. It depresses the lips on the inferior portion. It can also be referred to as the quadratus labii inferioris due to its quadrangular shape to it. However, the former name describes the movement a little bit better. Name these muscles. So both of these are encircling the eye, and they act as a sphincter to basically allow us to close and blink our eyelids. These are the orbicularis oculi muscles. Orbicularis, meaning it's circular. Oculus in architecture refers to the opening of a dome. The outer part is thicker and referred to as the orbital part, whereas the inner one is thinner and is referred to as the palpebral part. You can see the origins over here, more medially, and then laterally, the palpebral part inserts into the lateral palpebral raphe, whereas the orbital part inserts in the surrounding muscles. Sometimes you may hear of a third part to this muscle, referred to as the lacrimal part of the orbicularis oculi muscle, and it's not shown in this model because it's really small and has to deal with tear drainage. Name this muscle. Here are the origins, the alveolar processes of both the mandible and the maxilla. There is a third origin inside the mouth, the pterygomandibular raphe. It inserts into the orbicularis oris muscle. So when this muscle contracts, it compresses the cheeks and helps move food towards the molars in the back. This is the buccinator muscle. It can also be referred to as the trumpeter's muscle because it helps to propel air through the lips when blowing on a trumpet or other brass or wind instrument. Name this muscle. So the name for this one is very straightforward. It encompasses the nose, therefore we refer to it as the nasalis muscle. Now technically there are two parts to it. The transverse part is the only one that's shown on this model. It's more superior, and its main function is to compress the nostrils. The alar part's not shown on this model, but it would be lower and more superficial over the nasal cartilage. Its function is actually to open up the nostrils. Origin-wise, they originate on the maxilla. Here's the transverse part, and here's the alar part. The transverse part inserts into the aponeurotic fascia, whereas the alar part's going to insert into the nasal cartilage. Name this muscle. Here's the origin, the frontal process of the maxilla near the eye. Two insertions, one, the alar cartilage of the nose, and the other one more laterally, the skin of the upper part of the lip. This is commonly known as the levator labii superioris aliquae nasi. It elevates the lips and snarls the nose or flares it on one side. It can be referred to as the Elvis muscle for his famous smirk that lifts up the one side of the lips and flares out the nostril. And that will conclude our quiz on the muscles of facial expression. Do note that this quiz did not contain all of the muscles of facial expression, and I will have a demo video linked in the description below. Note that all of the facial muscles do have the same embryological origin, the second pharyngeal arch, and as such, they all have the same nerve supply. They're all innervated by cranial nerve number 7, the facial nerve shown over here. Also know that the facial muscles do not directly insert into the bone or move joints like most all other skeletal muscles do.